network governance has contributed much to the working of the health sector in the DRC, without which the sector maybe will not even exist. My name is Aembe Bwimana. I'm a student, PhD student at Wageningen University, conducting my research on network governance in fragile states. I did my research in the DRC from August 2013 to March 2015, about 18 months of fieldwork research. The field research was conducted in South Kivu, especially in Bukavu and Katana. Bukavu is the capital city of South Kivu province, the South Kivu province being one of the provinces of the DRC provinces. And also I conducted the research in Kinshasa at national level, at the Ministry of Health. The research is about the governance of health sector in a fragile state where the state is weak and relying on the inputs of non-state actors, especially donors. And then we try to look into the question of legitimacy. How does this input from external actors contribute to the legitimacy of the state? What is wrong with the health system in the DRC is that the share of the state for making the health sector functioning is too slim, too small, around 15%, while donors contribute with about 60% of the expenditures of the health sectors, and the remaining part share it's now from the households which are very poor. The effect of network governance in a fragile state, it's a very important issue now, because the state, when we talk about the fragility of the state, it means the state is not able to run the sector by itself. Then it requires the help, the assistance of other actors, especially in the case of the DRC, especially the donors, NGOs, but also other actors like churches. Non-state actors contribute directly to the state legitimacy. That cannot be said. It depends on how the work is being done and what is the discourse is being conveyed by those non-state actors. Network governance in fragile state has also its problems. There is a problem of trust, a problem of also defining their policy together. That is a major problem that I found out in that kind of governance, especially in fragile states. There is another problem that we found out in the network governance in the health sector in the DRC as a fragile state. Of course, the state is weak, but the political elite don't like to be taken as weak, to be considered as weak. Therefore, they like to impose their point of view, especially to have the control on the interventions being conducted by international actors. Another problem that we found out in network governance in a fragile state like the DRC is related to the sustainability of the interventions from donors and non-state actors. Because, you see, all the interventions, the schemes, the project, the programs are being managed, initiated and managed by international actors, supported by them. Then there is anxiety, a kind of anxiety of what will look those interventions once international actors have withdrawn from the DRC. I think the most important, the point on which we should concentrate, it's also how to make the state work. Without concentrating on making the state work, all those interventions will not sustain.